My name's Leila, and I'm the owner of Circle of Wellness, and we're here today to help you take preventative measures from having breathing problems from wearing masks, whether you are a child, an adolescent, or an adult or elderly, have any health issues prior to. So Bryan is in a moment going to show us how important breathing treatment is. We have a whole setup for that in machine, and he is certified and trained, and it'll read your CO2 levels. So I'm not the expert on it, but as he's doing the treatment on me, we'll kind of show you what to expect, and then he'll kind of explain what he's doing and why he's doing it and what the end results should be. So from what I understand, we are going to help repair or prevent damage that breathing issues or lack thereof may cause. All right, so one moment and we'll be right back. Okay, this is Bryan. He's our breathing specialist, and you see here the tubes in my nose. This is going to hook into...
This is a capnometer. This is the machine that actually does the CO2 retention reading for us, which it will display on the screen for us. We can see in real time somebody's breathing wave graph pattern and their CO2 retention. And so what I use this for is to see if somebody's levels are a part of a pain syndrome or condition, sometimes cognitive, sometimes for anxiety and fear. And I can talk a person through different breathing tactics to change what they see on the screen. When we change what we see on the screen, we're changing brain chemistry in real time. So yeah, this can help a lot of people for a lot of different reasons. And we are looking into seeing if we can use this to determine if the masks might be having an effect on people cognitively or in other areas of their health. So it can be useful, you know, for that as well, hopefully. But we're going to get Leila set up on the table and hook her up to the capnometer. Would you rather lie down, Leila, or stay standing?
I'll lie down.
Okay, go ahead.
Can you shut it off?
So first thing, we will connect client to the capnometer. Leila, go ahead and grab the end of your tube there. Thank you, ma'am. Now, you'll see the client is not wearing a mask. If she were wearing a mask, that would skew the result, right? So we are going to have her maskless. I am wearing my mask. Everybody is safe in here. And so what we do is find the client on the program and select. Now, Leila, when you're doing this, what I tell people is there are no absolute hard rules when it comes to breathing, right? But for our purposes today, because we're using a device to measure this, I'm going to need you to breathe out of your nose when you breathe out, okay? You can breathe in through your nose, you can breathe in through your mouth, but breathe out of your nose, because the way the machine works is that as Leila breathes out, this machine has a little pump on it that is helping draw the air that she's breathing out, and the gases from that air travel down this tube, go into this machine, and it does what it does to give us this reading that we will see on the computer in a moment. And get us started, and we'll record this session for posterity. Now, a lot of different programs that we can run with this machine. We're going to run just the CO2 graph training, and what this does is give us a real-time readout of where somebody's CO2 retention levels are. Breathe. Are you making the screen out? Or is that hard to make out?
I'm going to come a little closer.
Please do. Please do. Is it picking it up?
Yep,
okay,
I'm seeing the lines.
Beautiful. So what we have here is a scale of 0 to 50. And where most of us should be is at a level of 35 out of 50. This is a barometric pressure measurement. So what we can see right now is Leila is several points down, and she might be a little bit camera shy, a little bit nervous about being measured. This is typical right when I have somebody on the machine. Usually takes just a few minutes to get them back up to where we're going to be. So we'll try something really, really simple here. I'm going to put her through a very simple exercise to see if we can get this level to raise up in real time. Okay? So Leila, what you're going to try and do for me is you're going to try to have 3 seconds of breathing in. You're going to pause for 2 seconds and control that breath out for 5 whole seconds. Beautiful. Beautiful. Yeah. And then just, again, 5 count for letting that breath out. So you can see, guys, immediately when I task her, the wave shape changes. The level of retention went up just a little bit. My lady, I think I'm going to have you on this machine again. We're going to have to work on that breathing pattern. But what you can see is that what this gives us is a real-time biofeedback. As soon as she starts changing anything about the intensity or the rate of her breathing, we see a change in what we see on the machine. Now, the importance of this is that breathing dictates our body and brain chemistry in real time, by the breath and by the minute. It controls our pH balance, which in turn dictates so much more of your other body chemistry. So, in terms of anxiety and emotional disorders like that, we can determine based on these levels and how somebody is feeling while we're doing these tests, whether or not their breathing pattern has a lot to do with any of that stuff. And we can also communicate how the same chemistry in real time can propagate physical pain and chronic pain conditions, how people that are suffering autoimmune conditions can benefit from this. And my hope is in the very near future to do some differential cases of mask versus not wearing mask, maybe different types of masks, and play around with the timing for it as well. So yeah, hopefully this can be something that can help a lot of people with some of these issues. There's a lot of stuff going on people don't understand.
So, now that we know I'm a horrible breather,
yes,
what is my treatment?
Your treatment would be to see somebody like me until we can figure out what it's going to take to get you back up to that level and that you understand what you're doing to get there, right? One of the really fun things for me is when somebody comes in with spurious symptoms, things that don't seem to match up, and we take them through the exercises. Once I know somebody is really confident in their diaphragmatic breathing process, then I will actually have them breathe in a way that drops their levels really quickly. And a lot of times the response is, oh my God, this is what I feel like right before I have an anxiety attack or right before my headaches come on, which I love because I've taught them already how to change what they see on the screen to move things in the right direction.
So you would teach somebody the proper breathing mechanics to get past being a horrible breather.
That's it.
Right, or anxiety,
perfect.
Depression.
Yes.
Of course, respiratory issues.
Yes, and I stress to people, I do not have the type of license that lets me tell you what your feelings mean. But what we're doing here is strictly taking a measurement and then trying different exercises to see if we can create a change on the screen. And don't forget, when you see changes on the screen, you're experiencing real-time changes in brain and body chemistry. So yeah, I think it's really useful for anybody that just wants to learn more about their own breathing pattern or whether or not their breathing pattern is part of their pain picture.
And then each time you would show the patient their growth.
Absolutely.
Yeah.
Absolutely.
So you could see your actual beginning and middle and end results. So you see yourself that you are learning to breathe better, even when you're not in this room, is important.
Yes.
When we're at work, when we're in an intense situation, or just sitting and watching TV or looking at our phone, our breathing patterns change, which usually are not good. So we're just going to reprogram the brain.
Pretty much. And
teach you how to reprogram your brain.
It's a muscle memory.
Yeah.
The diaphragm's a muscle.
Kind of like slouching.
That's it.
It becomes a habit.
And it's
Bad breathing habits.
real-time feedback, which is you don't get with a lot of treatments. So
Yeah.
make a change, this thing
There's nothing fake about
highlights
it.
the change, and so we can work with that in real time. Yes,
Awesome.
yeah, beautiful.
Well, I'm excited.
All right, yeah.
Thank you, everyone.
Thanks, guys.
See you soon.